Hi, my name is Toshiaki Watanabe. I am the professor of Department of Surgical Oncology, the University of Tokyo, Japan. Today, I am going to talk about a randomized controlled trial entitled Comparison of Targeted versus Random Biopsies for Surveillance of Ulcerative Colitis Associated Colorectal Cancer. In long-standing ulcerative colitis, UC, the risk of colorectal cancer increases as the disease duration increases. The early detection of UC-associated colorectal cancer is essential for the successful management of long-standing UC. However, it is not always easy to endoscopically identify UC-associated colorectal cancer or dysplasia, because these lesions may be either invisible or difficult to identify. A random biopsy is recommended for surveillance of UC-associated colorectal cancer, but it has been recognized to be costly and time-consuming. Recently, a targeted biopsy has received much attention as an alternative method. However, very few studies have so far directly and prospectively compared the efficacy of a targeted biopsy with that of a random biopsy. It still remains controversial whether a targeted biopsy should completely replace a random biopsy. Therefore, we conducted a randomized controlled trial to compare neoplasia detection rate by targeted versus random biopsies in patients with UC. We performed a study in 246 UC patients from 52 institutions in Japan. Patients were randomly assigned to the random group or the target group. In the random group, 4 random biopsies were collected every 10 cm in addition to targeted biopsies. In the target group, biopsies were collected from locations of suspected neoplasia. The primary endpoint was the number of neoplastic lesions detected in a single surveillance colonoscopy. The non-inferiority margin was set at 0.65 for the ratio of the mean number of neoplastic lesions between two groups. The average number of biopsies containing neoplastic tissue per colonoscopy was 0.211 in the target group and 0.168 in the random group. P-value for non-inferiority was 0.018. Neoplasia was detected in 11.4% of patients in the target group and 9.3% in the random group. In the random group, the number of biopsy samples per colonoscopy was larger and the total examination type was longer. In the random group, all neoplastic tissues in random biopsies were collected from the mucosa with a history or presence of inflammation. In conclusion, in a randomized controlled trial, we found that targeted and random biopsies detect similar proportions of neoplasia. However, a targeted biopsy appears to be a more cost-effective method. Random biopsies from areas without any signs of present or past inflammation were not found to contain neoplastic tissues. Thank you very much.